Hello, I'm Dr. John Kisiel, a physician in the Division of Gastroenterology and Hepatology at Mayo Clinic in Rochester, Minnesota. The organizers of Digestive Disease Week have invited me to share with you results of a study titled Methylated EYA4 gene in the non-neoplastic mucosa of ulcerative colitis patients with colorectal cancer, evidence for a field effect. Patients with chronic ulcerative colitis are at increased risk for colorectal cancer. We have previously demonstrated that aberrant methylation of the Eyes absent 4 gene, or EYA4, is highly predictive of colitis-associated cancers and precancers in both tissue and stool samples. Meanwhile, our collaborators have shown that elevated methylation markers found in colitis-associated cancers can also be found in the inflamed tissues of the same patients at anatomic sites distant from their primary tumor. Because a large area of the surface of the colon may be affected, this phenomenon has been termed a field cancerization defect, or field effect for short. Because we're interested in developing methylated EYA4 as a surveillance tool for colitis-associated cancers, we felt it would be important to determine if methylated EYA4 were confined to the colitis-associated cancers, or if they could also be found in the inflamed tissues of patients already known to have a colorectal cancer. To answer this question, we obtained tissue samples from colitis patients who had undergone surgery. 20 of these patients had undergone surgery to treat colitis-associated cancers, and 20 of these patients underwent surgery for other reasons. Among the cancer subjects, we sampled additional tissues at distant anatomic sites from their primary tumor. By design, the patients in both groups were very similar with respect to other known risk factors for colitis-associated cancers. After extracting the DNA from the tissue samples, we used a technique called methylation-specific polymerase chain reaction to measure the copies of methylated EYA4. Not surprisingly, methylated EYA4 was found at very high levels in the colitis-associated cancers when compared to controls. However, high levels of methylated EYA4 were also found in the non-cancerous tissues of the cancer subjects, on average 13 times higher than when compared to controls. We used a technique called logistic regression to study the accuracy of methylated EYA4 in the non-cancerous tissues for predicting a synchronous or coexisting colorectal cancer. At a stringent 95% specificity cutoff, high levels of methylated EYA4 were found in half of the non-cancerous tissue samples of the cancer patients. In other terms, the odds of a high methylated EYA4 in the non-cancerous tissues of cancer subjects was 19 times higher than the odds of methylated EYA4 in the control samples. In this study, we have identified that methylated EYA4 is highly predictive of a synchronous colorectal cancer. The magnitude of this effect is similar to markers reported by other investigators in the medical literature, and this finding has important implications for the use of methylated EYA4 as a screening test for colitis-associated cancers and precancers. More specifically, if a patient had a normal surveillance colonoscopy but a high methylated EYA4 level, that patient may still be at increased risk for colitis-associated cancers and require a higher level of surveillance, such as the use of more frequent colonoscopy, or that patient may benefit from the use of enhanced endoscopic imaging techniques. Thank you very much for your time and allowing us to share these exciting results.